Earlier this month, the U.S. Surgeon General issued a warning that social media poses a profound risk of harm to kids' mental health, as compulsive use has been linked with sleep problems, attention issues, and feelings of low self-esteem, exclusion, or even worse. This as an estimated 95% of teens 13 to 17 years old use social media.
Dr. Jason Nagata is an assistant professor of pediatrics and adolescent medicine at UC San Francisco. His latest work focuses on screen habits and sleep. He joins us now. Good to see you, doctor. Thanks for being with us.
Thanks so much for having me.
I want to know who those teens are who don't use social media, but let's focus
5%.
on your study. What were your main findings that you found?
Yeah, we found that 2/3 of teenagers reported having an electronic device in their bedroom, and actually 17% said that they were woken up overnight by notifications or calls. And similarly, about 15% said that they had trouble falling or staying asleep in the past couple of weeks.
Since this is something that you study all the time, this doesn't necessarily surprise you, does it?
No, it doesn't surprise us, but I think especially given these new warnings from the Surgeon General, it's a good reminder that we can really optimize our sleep habits, especially for our kids and for us ourselves.
Well, we do have some of those tips that we want to share with parents out there who might be watching tonight. So let's put those up on the screen if we can. That would be good. So I know that tip number 1, Dr. Nagata, is to avoid social media or other electronic devices before bedtime. Is there a time frame within that?
Yeah, in general, the American Academy of Pediatrics recommends about 60 minutes before going to bed, trying to wind down and turn off devices and notifications, because we do know that social media content and engagement can be stimulating and activating. But I think in general, just giving yourself that time so that you can wind down and not be super activated or thinking about new things right before bed.
How realistic is this to pull the phone away from the kid before they go to bed?
I mean, I do think that one of the challenges for all of us is to really, I think, model good behaviors. And so one thing is, I think it's hard for all of us. You know, we're all connected to different devices, but I think it really is essential because most kids do not get enough sleep, and that can really affect their physical health and mental health. So even if it's hard, I think it still is something we need to try to do.
And one thing,
I mean, actually, one recommendation that we have from our research is actually to keep the phone outside of the bedroom altogether. We found that, you know, 2/3 of teens have phones in their bedroom, and then they're more likely to get notifications. And if they wake up overnight, you know, they might check their phone or social media. But I think having it physically in a different room may actually help to prevent that.
Yeah, I'm sure, though, that some teens will fight with their parents and say, no, it needs to be in there. I'm sure that's an issue as well. So this goes for, to your point, though, this goes for adults, because if you're a mom, if you're a dad, the kid will say, well, you do it, why can't I? Yeah,
I think one of the biggest predictors of kids' screen and social media use is their parents' media use. So if you're going to recommend, you know, turning off devices before bedtime, then I think it's good to practice what you preach.
Yeah, although that is challenging, because I know I certainly have woken up in the middle of the night, and then you look at the phone, and then all of a sudden you end up down this rabbit hole that you're
video
on for a very long time, and then you can't go back to bed. So it's important to be reminded of all of this. Dr. Jason Nagata, thank you for the research, and thank you for the important reminder.
Thanks so much for having me.
And hello to your parents. You are in the Bay Area, but they live down here. This is where you're from. So glad that you're with us tonight and they can see you locally.